Joining us this morning is Kelly Clark. She is the Marketing and Communication Specialist with Titusville Area Hospital. Hi, Kelly. How are you?
Hi.
Good
how
to
are you
see
doing
you.
today? Good to see you.
Hey, I'm excited. You brought a special guest in today.
I did. I brought Rachel Rubaker in with me today. She is one of the part of the behavioral health program that we offer at Titusville Area Hospital. So she's going to talk a little bit about what she does there, and yeah.
Okay, no, wait a second. Was this for the interview or was this for me? The
What?
behavioral health part of it. I'm confused.
Well,
Oh, man.
We'll find out more. I'm
yeah.
nervous. Now
We'll see if
I'm
we-
nervous.
See
yeah.
if we can help you.
Well, Rachel, thanks for joining us here
Yeah,
today.
thank
Good to
you
see
for having me.
So tell us a little bit about yourself.
Sure. So I was born and raised in the Titusville area. I graduated from Titusville High School. I went to college at Edinburgh University, got my master's in social work there, and then later on I was able to go to get my clinical license in social work.
Excellent. What age did you know that this was the field you wanted to get into?
I think right around high school, I started taking psychology classes in high school, and I was really interested in them and how the brain works and why people do the things that they do, and so ever since then I was kind of hooked.
I have to ask, was there like a backup just in case maybe you decided you didn't want to do that?
Not really, to
Okay.
be honest. Yeah, I kind of knew that was the field for me as soon as I got into it.
Excellent. And then as you get started down that course, was there something that happened or a class you took or, a professor, somebody that you just said, okay, yeah, I know for sure that this is what I want to do?
Actually, yes. So I took my first 2 years at Pitt in Titusville, and there was an abnormal psychology professor who was incredibly passionate about the subject. And so in the abnormal psychology classes, they talk about all of the different disorders, and they go through, everything that can kind of happen mentally for a person as time goes on. And I just thought that was so incredibly interesting. And the professor was so passionate about it that I think it was impossible not to be interested in the subject.
That's great. And I would imagine just in this field alone, every day is probably a little different for you. Every patient's different.
Yes. Oh, absolutely. Yeah, you kind of have to take it as you go. And we have to meet clients where they're at. Sometimes people come in and their life is in a crisis. And so that is, a little bit different than people who are just kind of coming in for maintenance sorts of mental health services.
So what ages do you see?
We see ages 8 and up.
Wow.
Yep.
So maybe can you give us just a little snapshot of maybe some things that you would see, at 8 versus 15 versus, 30s and up?
Sure. So,
And I know that's a really generic question, but what are some challenges facing these, all the different demographics?
absolutely. Well, and so for our younger clients coming in, a lot of times it's issues in school. That's a huge stressor for kids. I want to say like to the 8 to 18 range, that school age range. School can be a huge stressor. And there's actually a lot going on in these kids' lives sometimes outside in the family or what have you. So most of the time it's focused on issues like that, kind of getting them through, helping them find coping strategies so that they can kind of manage what's going on in their lives. And for the adults, oh man, it's really a mixed bag sometimes. People can come in with anxiety, depression. Sometimes we treat PTSD, trauma. People come in for, oh man, a multitude of reasons.
Isn't it amazing? I'm sure you have people that you see who say, I don't need to talk to somebody, I'm fine. And then they just sort of open up and it's a floodgate and it's like, I feel better.
Yes, that happens all the time. And what's funny is clients will come in and they'll say like, I don't know why I'm struggling. I had a really good childhood. Like everything in my life has actually been really great. And once we kind of dig deeper into things, usually there's some underlying stuff that they had never even considered that's affecting them.
That's interesting because sometimes it's probably very obvious and then sometimes it's something maybe so subtle and it has to be probably challenging for you to kind of find that, right? Like a detective.
Yeah, oh, absolutely. It is. Yeah, it is a little bit like being a detective sometimes.
Yeah. Kelly, what a great asset to the hospital.
Yes, she is one of our 2 counselors right now. We also have Jennifer Chase that is doing basically the same things as Rachel. And we also have Melinda Douglas. She is doing the medication management portion of the behavioral health. So maybe if you do need to, be on medication for any kind of mental illness, she's there at the hospital on a full-time basis now to help manage those medications.
That's fantastic.
It's kind of the whole package that we offer now at the hospital, which has really been helpful. They've been really busy. So, we look at, what is the need in the area. And that was one of the needs for the area, especially for the younger kids and serving those kids from age 8 and up. And they've been really busy. So
yeah,
it's definitely has been a need.
So Kelly, the information, does that come from surveys that patients take? Does that come from doctors saying, hey, I think we really need to have this to help us? I mean, is it everything?
It's a little bit of both. I know Dr. Munoz, she's our pediatrician here in the area. Most people know her. And I know that was definitely something that she had made us aware of, that's definitely a need for kids in the area. And, in a lot of different aspects, all of our PCPs, are consistently reaching out. We don't like to send people to, a far distance. If you have to go to Erie, that's hard, or, anywhere outside of the area. On a regular basis, a lot of these patients are seen weekly.
Yep.
So to pull your kids out of school and drive the whole way to Meadville, that takes half a day of their school way. So, yeah, it's definitely a collection of information, but mostly it is from the doctors.
And that can be stressful. I mean, just you taking half a day, driving somewhere else, and then you're missing stuff, or that really doesn't help the situation, does it?
No, it's a huge barrier to treatment, absolutely, to people getting these services.
Now, I'm going to throw myself under the bus. Like when my wife and I are having conversations, I don't know. I think maybe, I don't say typical male, but bottle it up when maybe I should have conversations, right? But it's very hard to do that. Do you find it is hard for patients to have conversations with you, or, that initial meeting with them? Is it trying to get them to open up?
Oh, absolutely. And, sometimes it really depends on the person. Sometimes people come in and maybe they've had therapy before, so they kind of know the process, and they're really wanting to dig into it. But you're absolutely right. Some people come to me and they're like, I've never done this before. This is really scary to me. And it is just kind of making them feel comfortable enough and giving them the tools so that they can start opening up and digging into these issues. Yeah,
and then you think, going back to students, there's just so much going on in their lives. Sports, extracurricular activities. Yeah. You mentioned, you don't know what family life is like, and then they come. For some kids, the best 8 hours of their day is at school.
Yeah.
But if they're having problems, that could be disrupting the classroom, which affects everybody else. Yes. It affects the teachers. There's really a lot to that.
Absolutely.
So what sort of things, and we'll stick with kids for a moment, if a parent notices these traits, maybe they should be making that phone call?
Sure. So I think if you're noticing that your child is starting to struggle in school, that maybe, you're getting a lot of notes from the teacher saying that they're having issues, behaving in class or getting along with other children. Sometimes parents will notice, especially as kids kind of creep up into the teen years, that depression and anxiety becomes very, very, prevalent. And so I think if those sorts of things start happening, you notice a significant change in your child's mood or behavior, it might be worth a call.
And at that age, that's normal, right? I mean,
Sure.
It's okay to experience this.
Yes, and sometimes navigating that is very hard for parents. What is normal behavior for teens at this age, and what is something that we need to be concerned about?
Now let's diagnose Kelly. No, just joking.
Good luck.
Kelly, we've talked over the years, and you bring in great guests all the time, like Rachel, and when you hear a doctor say, I have a patient who's struggling with this issue, and it's sort of out of their realm, right? It's now the mind type of thing.
Sure.
It is so exciting to know that there's somebody here, there's an office of people that can sit down with you and have that conversation. So if we talked about kids, now let's go to adults, but you're in the workplace and you're having different thoughts. You're depressed. Maybe you're working a lot of extra hours because businesses are struggling to hire. I mean, there's a lot of factors that can come into just, needing that release and talking to somebody.
Right. Absolutely.
Kelly, what's the first step in being able to see somebody like Rachel? Is it talking to their primary care physician?
You can talk to your primary care physician. Depending on insurance, you can be a self-referral. It really just depends on, like I said, your coverage for your insurance. Most insurances are accepted, and they do cover her services like a specialty service.
Okay.
So that is really exciting for a lot of people to have that covered, especially locally, by your insurance. So there's not a ton of cost involved. And like I said, every insurance is a little bit different. So starting that process, a good place to start is with your doctor. And if you have been keeping up with regular appointments, they probably already know a little bit of your history. I know every time you go to the doctor, mental health is the top priority. You usually have to fill out a questionnaire of how you're feeling and, if self-harm is an issue or things like that. And, so a lot of the doctors, they already know that it's time to reach out when they're getting that information. But if you're not, sure, maybe I do need to talk to somebody, you can always reach out and to your doctor, get that referral, go for the first appointment, and see if that's something that's going to be helpful to you.
Rachel, we're going to come back to you in a moment.
Okay.
Kelly, we've got some other things happening. Crawford Gives is coming up.
Yes, Crawford Gives is coming up in, I believe, 2 days. Yeah. So it's going to start on Saturday, August 24th, and it runs through Tuesday, August 27th. These days of giving are put on by the Crawford Heritage Community Foundation, and it's just an event to really showcase all of the nonprofits in Crawford County, and it's an event that's online. You can also send a check in if you would like. All the information is online though, and our push right now is for the ICU in the hospital. It's getting a facelift, a renovation. So really excited about that, and we're raising funds towards that. So if anyone's interested in donating towards that, you can start donating on Saturday.
That's fantastic.
Yeah.
All right. Help support just the improvements at the hospital. I was talking to somebody the other day, and they said that they came through, and it's been a while, and they were just blown away by how inviting it is to come in there, and everybody was so friendly. So congratulations.
Thank you.
A lot of improvements over the years, and it's continuing here. So here's your chance to help.
Yeah.
Let's do this real quick. You're watching the Morning Drill on Stream Television and on Armstrong's Neighborhood Channel. It comes from Titusville Area Hospital with us here this morning. Some other big news.
Yeah, so we have a new athletic trainer, Heather Hunter. She joined us, and she is going to be giving her services to the Titusville Area School District. So you'll see her on the sidelines at all the games. She has over 10 years experience on college level and at the high school level. So just a wealth of information. I actually had her with me yesterday at a lunch with Kai Skinner, talking about concussion, and it's really just a great collaboration between the hospital and the school, and taking care of those kiddos that are doing through the athletics program. So
that's great.
Yeah,
I'll tell you
we're
what,
really happy to have her aboard.
We're so lucky, and I don't know if that's like across the board with all schools, but just to have the resources of the hospital as part of the athletic program is fantastic.
Oh, yeah. Yes.
And not just the football players and soccer players involved. I mean, like if something happens and you're in the band, or something happens to somebody walking through school and the trainer's there, they're there to help.
Right.
So
right, and they have that connection with the hospital to get you in touch with all of the services needed. She's working closely with Kai through concussion services that he's offering, making sure that everyone that is going back, if you have had an injury, is being taken care of before they're put back on the field. So it's really just keeping the kids safe. So.
And Rachel, I would imagine there could be a mental aspect to that.
Absolutely. Yes, definitely.
What's next, Kelly?
So we also have a new surgeon that just joined us, Dr. De La Vega. She is going to be working part-time at Titusville and just offering more services through our surgical program. So she'll be working closely with Dr. Rogers and also Dr. Shore. So we now have 3 surgeons at Titusville.
Wow.
So yes, really expanding those services just because they are definitely needed. So we're very excited to have her aboard as well.
Rachel, when you had the opportunity to come work for Titusville Area Hospital, did any of the growth, the investment back in the hospital play a role in saying, yeah, this is important to be here?
Oh, absolutely. Yeah. I think serving the community in this way is so important because, like Kelly was saying, this is a need in this area, very much so. And I'm just so happy to be able to be a part of it and give back. And yeah.
All right. And you too can give back with
You too
Crawford
can give
Gives.
back.
Yes. Rachel, what would you like people to know about your practice, what you do, and the patients that you'd like to see?
Sure. So I think that therapy can be for anybody. I think if you're considering, receiving services from a therapist, I would say that there's absolutely no shame in doing so. Again, I'm a firm believer that just about anybody can benefit from therapy. Even if you're well adjusted and things are going well, there are still things that happen in our lives that are difficult that maybe we need, a listening ear or someone to kind of help us navigate those things. And so we're here to help. And so I do hope that people utilize these services and get them if they need to.
Kelly, again, it's just a conversation to have with your primary care physician to start, and again, we could sit here probably all day and just name different scenarios that might impact you in a certain way that you think, okay, maybe I need to talk to somebody and have this conversation.
Yeah.
Right?
So just get a hold of your.
Life events that happen. You might have never considered therapy in the past, but you might be a new mother. You might be, recently divorced, recently lost a loved one. They offer grief support, trauma support, and really just like she said, somebody to talk to open up about those things that, you're getting through life, keep moving forward, but to really feel better, maybe it is worth going to counseling and getting that extra service that you need.
Rachel, would you say it's open to anyone, like individuals, families?
Yes.
Okay.
Yep. Individuals and families, ages 8 and up. Yeah, we can do family counseling as well. If there's issues within the family dynamic, things going on, maybe a lack of communication between parents and kids, that's also something that we can address.
If you're somebody, or maybe a couple, and you think, hey, things are great, we have a good life, what can somebody like that get out of going to you and just having these healthy conversations?
Sure. So I think, communication is a huge part of that. And, even if you are thinking like, okay, things are going really well right now, therapy can still help teach you those strategies for, okay, maybe when things are not so great, here are some things that we can use to kind of get through this time and grow stronger together.
Okay. So, really, the door's open for everybody.
Yeah. Yep.
And as you said, Kelly, there's times where maybe something happens. It might just be minor, but maybe it's just good to talk to somebody.
Sure.
Yes, exactly. And, they are, have seen a lot of things, have dealt with a lot of different issues. They have the tools and the training to help you. Instead of you, struggling along for a year, maybe you could only have to struggle along for, a matter of months and really get the help you need and come out of the other side of those life events that may be holding you back.
Rachel, is it just dependent on who you're seeing that determines the length of time they're going to see you?
Yes, absolutely. The individual need, where they're at, absolutely. So sometimes I see clients for a very short period of time, a couple of months. Sometimes I see them for a few years. It really depends on what's going on in their life and if they feel that they need to continue.
All right. Kelly, wrapping up summer, heading into fall. Boy, that's kind of... Well, I love fall, so I'm very excited. But for those who are struggling with summer ending, they can come and talk to you, Rachel. just give us a quick snapshot of the summer. It's been a busy couple months.
It has been a very busy couple of months. Yes, we finished our oncology renovation.
It seemed like just yesterday, though.
I know, right?
Ribbon cutting and
Yeah, so we finished our oncology department, and that was a pretty big project for us. We raised a lot of money, and it's going really well. I've talked to some folks that have been receiving services there, and they said what a difference it has made. It's just bright and happy and a really comfortable place to receive oncology treatments. So that was exciting. We had our golf outing. We raised the most money that we've ever raised for our golf outing, so that was exciting. And now we're heading into fall with new projects, new services. Crawford Gives is coming up, so yes, it never really stops. It just keeps just keeps moving
keeps
forward.
going. Yeah. Rachel, again, lots of reasons to pick up the phone and at least get that conversation started and get to your services. And thanks for all you do. It's very important. And,
Yeah,
you know,
and if you want to reach out to her office specifically, the number is 814-827-9770. If you just want to call the office and maybe get some more information, that's also an option.
yeah, and I'm sure if just the day-to-day, you know somebody who it might benefit them to have that conversation, to at least initiate the call and get things going. Are there certain things somebody should say to their doctor, or should they just come out and say, I think I need to talk to somebody?
I think it can be that simple.
Okay.
Yeah, absolutely. And we even take self-referrals as well. So you can call that number and just let the receptionist know that you want to get counseling services.
All right. Rachel, Kelly, good to see you. Thanks for
Good
your
to
time.
see you.
Thank you.
Thank you.